Let us now go to epigastric pain. The topic is diagnosis. Diagnostic symptoms and signs in epigastric pain include the nature, time, and amelioration or aggravation of the pain. If the nature of pain is severe, it's an excess condition. If it's dull, it's deficiency condition. If it is stabbing, it's stasis of blood. Distending is stagnation of qi. Burning is heat. And if the pain is with a feeling of fullness, that is dampness. If the time of pain is in the morning, that's an indication of deficiency. If it's in the afternoon, it's stagnation of qi, and at night is stasis of blood. For amelioration or aggravation of pain, if it's better after eating, that's an indication of deficiency. If it's worse after eating, it's excess. If it's better with pressure, that's also a deficiency, and if it's worse with pressure, it's also excess. Better with application of heat or drinking hot fluids is a sign of cold. If it's better with rest, it's deficiency. If it's better with slight exercise, it's stagnation of qi or blood. If it's better after vomiting, that's excess condition, and worse after vomiting is deficiency condition. When diagnosing epigastric pain, questions about thirst, taste, belching, regurgitation, vomiting, fullness, and distension are important. Let's look at the character of epigastric pain according to heat, cold, and deficiency excess. For deficiency heat, there will be dull pain with slight burning sensation, dry mouth, desire to sip fluids, the tongue red with wide midline crack without coating. If it is excess heat, there will be intense burning pain that is worse after eating, thirst with desire to drink cold fluids, with tongue red with dry yellow coating. If it's deficient cold, there will be dull pain with preference for warm drinks and application of heat, with no thirst and vomiting of thin fluids and an empty pulse. For excess cold, there will be severe spastic pain with no thirst, vomiting, thick white tongue coating, and a full tight pulse. If the thirst is intense with desire to drink cold fluids, that's an indication of full heat. If there's dry mouth with desire to sip fluids, it's empty heat or yin deficiency. If there's absence of thirst, that's an indication of cold, and thirst without a desire to drink is damp heat. If the taste is sticky, that's an indication of dampness. If it's bitter, there's heat. If it's sweet, it's damp heat. And the sour taste is retention of food, and the absence of taste is spleen deficiency. If there is loud belching, that's an indication of an excess condition. And for a quiet belching, that's indication of deficiency condition. If it's better after belching, that's stagnation of qi. If there's sour regurgitation, that's retention of food or stagnant liver qi invading the stomach. For regurgitation of thin fluids, that's deficient cold condition or phlegm fluids in the stomach. Thank you so much for your attention.